that when sex is going well in a relationship, it adds about 20% of the value to it. So it's a good thing.
Mm-hmm.
But when it's not, when one person or both needs are not being met sexually, it can drain a healthy relationship up to 70% of anything that's good, leaving it feeling pretty empty. So now, instead of like feeling frustrated, I'm not getting there, it can help to build that arousal. So now you're in that state of like, oh, I'm just really present. I'm in my body. I'm not thinking about things anymore.
Today, we have a special guest on the show, Maureen Ryan. Maureen is a nurse practitioner specializing in intimacy and sexual health and has been in practice for over 13 years. Maureen has a doctorate in nursing practice and dual licenses as an adult health nurse practitioner and women's health nurse practitioner. She is also an AASECT certified sexuality counselor and a certified coach. Maureen, welcome to the Functional Nurse Practitioner Podcast.
Thank you, Tara. I'm really glad to be here.
Well, we are very excited to have you here today, and I have a bunch of very interesting questions. And for the listeners out there, we are getting into some very interesting topics today, things I've never covered. So I would grab a pen and paper or a notebook, or definitely come back, bookmark this episode so you can listen to it as many times as you need to really jump into this important information. So, Maureen, before we dive into the topics, I always like to ask I feel, very important topic, an important question. What led you down the road that you're on to specialize in for what you do? Like, what is your story?
Okay. So, interesting story. I am a nurse practitioner. I was practicing in a women's clinic for over 10 years. And you would think that a woman would go to her GYN if she's experiencing intimacy or sexual concerns. And I know my patients were struggling with these issues, but I didn't ask them the questions. So the focus was how not to get pregnant, how not to get an STI. It wasn't about how is your relationship, how's the quality, are you satisfied with your sex life? Are you happy with the intimacy, level of intimacy you have? So I know this is really important to quality of people's lives. And the questions weren't being asked. And I wasn't alone. My colleagues, I think the majority of them weren't asking either because we were not trained. That's one factor. The other factor is that we have a limited time with our patients. So anyway, I saw that there was a need, and then I went to become a certified sex therapist. I went to a year-long program, and since then, in 2011, I've had my own practice. It's virtual now since COVID, and then after that, I came upon coaching, and the model for coaching really resonated with me, especially when it comes to sexual health. So it's all about helping people identify their vision. What is it they want? What do they want to experience? What do they want it to look like? What are the barriers? And we would call the barriers sexual dysfunctions or sexual concerns. And then what strategies do you have that can help get you to where you want to be? So that's a great model for this type of work.
Well, I love that. And it's very interesting. And I feel like people need to know, they need to know this information. It's a huge part of life. And it's something that so many individuals are not talking about. So it's very, very important information. And I'm sure people are on the edge of their seats right now. Like, what are we going to be talking about today? Yeah. So let's start with I
want to say one thing first.
Are you currently suffering with Hashimoto's? Have you been told there is nothing you can do? Are you tired of the never-ending fatigue? Are you ready to overcome the debilitating brain fog, anxiety, joint pain? I created a masterclass where we dive into the underlying root causes of Hashimoto's so we can get you on a different pathway. One that leads to not only improving your symptoms, but transforming your health. For now, I'm offering this masterclass for free because I know how it feels to keep searching for answers and coming up empty-handed. If you'd like to gain instant access to this masterclass, comment down below masterclass and I will send you the link. Now, back to today's episode.
First is that when it comes to intimate relationships, people want three things. They want emotional intimacy, so they want to feel like their partner's got their back. They can talk to them about anything. They can be transparent. They're not going to be judged. So that degree of emotional intimacy. They want commitment, and they want romance or passion. And so if that romance and passion is missing, you end up with a companionable relationship, which is great for many people if neither one of them are interested in having a sexual relationship. But a lot of people get stuck there and they long for something. They know something's missing, but they don't know how to identify it or get there.
Yeah, absolutely. I can appreciate that. And I would love for you to like debunk some of like the myths surrounding sexual health and intimacy.
All right. Well, there's a lot of them. So we never get really good education, sexual health education. And also, a lot of people don't have really good role models when it comes to, really, showing what a healthy relationship looks like. So people buy into things that they learn from social media or messages that they got growing up, maybe religious messages, things like that, and they get stuck. And so common one is that sex should be spontaneous. Now, it may be at the beginning of a relationship, that 3 months to 2 year period when everything is new and exciting and there's, your brain is being flooded with dopamine and endorphins and you're totally high. I mean, that's a great place to be, but it doesn't last. So what happens then, that romance turns into more of an attachment love, and they're fed by different neurotransmitters. So dopamine being one for that desire and, that longing, that wanting to have. And then attachment is more oxytocin based. So spontaneous desire is there at the beginning of a relationship for most people. But as time goes on, you become more familiar and things are more predictable and life, gets happening. You have responsibilities and maybe kids and jobs and all of those things. It starts to peter out, that spontaneous desire. And that's where people think something's wrong with them. Because I never think about sex. I wouldn't initiate it if my partner didn't. It's just not on my radar. But when they do, when they are intimate, this goes for men and women, but more so women. If they allow themselves time to relax and to become present, their body's going to get aroused. Once the arousal occurs, then desire comes. So I ask them, like, do you enjoy the intimacy? Is it pleasurable? Do you get aroused? Do you experience an orgasm? And they say, yes, yes, yes. Well, there's nothing wrong with you. You have responsive desire, which is what 80, actually more than 70% of people identify with in long-term relationships. So really that spontaneous sex, you can be waiting a long time for that to happen. And sex really can be the glue of a relationship. So at this point, it really needs to be intentional, like put it on your radar. And then in order to do that, you really have to come up with your motivators, your why. So anyway, the myth of that sex should be spontaneous is one. That is not true.
Yeah. And I'm sure a lot of people, I can't be the only one, like, not to get too personal, but come on, friends, we're getting personal today. Like
right.
Years ago, that was me, like thinking there was something wrong with me, or like the relationship and that excitement feeling not being the same can be so hard.
Right. And that's when people think, oh, I'm out of love. I'm not in love anymore. No, you just have to understand what's really happening here.
Yeah. And I remember back in my women's health days, asking, because women would come in and say, like, there's just something wrong with them. They have no libido, like they're everything is ruined, or it's their hormones and all of these things. And when we would really get into it, I'm trying to think of anybody. I feel like every single one was like, oh yeah, if we get started, I get into it.
Right.
But I'm just not thinking about it. But then we're thinking like it should be on my mind like it was when I was a teenager, and we're all different, right? So
Yeah. But then when you get into the shoulds, that's when you get into trouble, right? It should be. It should be on my mind. But who says so? Maybe you want it to be on your mind. And so that's where it really comes into, getting clear with why is this important to me? Why does it matter? And there's so many occasions where somebody is saying no. No, I'm not interested. No, I don't feel like it. I have a headache, like that. Every time that happens, the partner kind of starts to feel rejected. If it happens all the time, they can really feel rejected. And that's where relationships get into a lot of trouble. So I always tell people, think about hard no's and soft no's. So a hard no is like, no, I'm not interested in being sexual right now. I'm walking out the door. I'm going to work. I got a sick kid. There is a reason why no. And there's the soft no's where you finally get everybody settled down or get your work done, and you sit down and like, oh, I'm going to watch my Netflix show. And then your partner gives you the look and you're like, oh my God. But you don't do that. Oh my God. You're like, okay, now in my head, I'm thinking of all the my reasons why, having a healthy sexual relationship is important. So now I've got my motivators. So then I'm like, sure, let's see what's possible. So all you have to do is go in with the willingness to see what's possible. And then most times that's going to turn into a yes. And it's also like, I use the analogy of the gym too. It's like you got 100 reasons to go to the gym. You got 100 reasons to have a healthy sex life, right? There's 200 and some reasons why people have sex. They did a study on this.
Oh, wow.
Yeah, it's like 230 or something. And so obviously there's more than that, but so it's like going to the gym. Like I really don't feel like it, but because I know there's value in it, I'm going to drag myself to the gym. Once I get started, I'm going to be like, okay, I'm starting to feel better. And then when you're done, it's like, wow, I feel really good. I'm really glad I came here. Same thing with sex. You got to show up. You got to start playing the game to want to be in the game.
Okay. Well, how about if you have a couple and one person's in the game and the other one keeps making excuses? Like,
right. And that's where, relationships can fall apart. So Michael Metz is a therapist, and he's done a lot of research. He's been around for like 40 years. Actually, he did pass a few years ago, but his research showed that when sex is going well in a relationship, it adds about 20% of the value to it. So it's a good thing. But when it's not, when one person or both needs are not being met sexually, it can drain a healthy relationship up to 70% of anything that's good, leaving it feeling pretty empty.
wow.
So people understanding that and the value, that can be a motivator that, I'm really not interested because, for all sorts of reasons that can be, looked at and, and beliefs that can be shifted when you see the value in it. And if you've got a relationship that's not healthy, where one or both are abusive in any way, a lot of resentment, anger, well, you got to deal with those things first, typically.
Yeah, that makes a lot of sense.
Yeah.
So you said like the soft no or the hard no, and the importance of intimacy being one of the myths. How about debunking another myth?
Okay, so another common one is that sex equals intercourse. And if intercourse doesn't go as planned, so arousal for both desire arousal for both partners, a firm erection, and then ending in intercourse and orgasm, every step of that can be great. The couple can be enjoying the experience. But if a man loses his erection and is unable to, complete intercourse, if that's what they wanted, that was their goal, their vision, they can think the whole thing was like a failure. And so you get a couple of those and couples stop touching. So,
Okay.
yeah. So you've got to understand how to roll with that, because every man is going to experience ED at some point. I mean, 50% of men in their 50s will experience it sometime. It's just, being fatigued, stress, all factors like that, because let's face it, we're human beings, right?
Yeah.
Not machines. So being able to roll with it when it does happen, not making it a big deal, but like, okay, let's do something else and go and, do something else. Don't just, when somebody, this is what happens with some couples is if a man loses erection, it's all done. And they turn over and they both feel really defeated.
Yeah.
Or she feels unwanted, like, I'm not enough. He's not attracted to me. Make up all sorts of stories. So really expanding the idea that sex is not just about intercourse, it's a whole body experience, and not putting success or failure as a label on something, but enjoying it every step of the way. If it doesn't go the way you want, go to plan B, go to plan C. Just like you can make a gourmet meal, you can burn it. Doesn't mean you stop eating, right? So order out for pizza, right?
I love the analogy also, but I love that you brought that up, because I'm like, for me, just in life, I am like I want everything to go according to plan for sure.
How's that working for you?
And it's not, and I mean, I try, like, I'll roll with it, but like begrudgingly, right? Like I want things to be the way that I envision them to be. And I feel like so many of us feel that way. And
Yeah.
you touched on something so important, because and I don't think it's just women. I think it's anybody, men and whoever, that we have this idea of what something should be. Like,
Mm-hmm.
they look at me, my partner looks at me, they give me that look, and then now, like, the candles are going to be lit or the music's going to go on, and like thinking, like, romanticizing things, like we see a movie and it should be like that. And if we fumble along the way, if things aren't maybe like the definition of sexy from like the greatest Netflix movie or something
Right.
trending somewhere, that then it's a bust. And
Right.
and you said that it isn't just intercourse.
Mhm.
That's, you would think that that's understood, but I don't think it is.
No, and that's how couples stop having sex. Is that when a man experiences ED for the first time, no big deal. Second time, it's like, what's going on here? Third time, they become hyper vigilant, and now all they're doing is like monitoring how hard their erection is, and so just like you were describing the disease of women, which is perfectionism,
Mm-hmm.
for men, do you know what their kryptonite is?
I'm guessing it has something to do with an erection.
They don't want to be seen as weak.
Yes.
Until they equate that with weakness. And so nobody wants to experience that, so they'll start to avoid. And then couples stop touching because they don't want it to lead to something or embarrass one or the other. But I'm going back to Michael Metz too. He developed this model, him and I think it was with Barry McCarthy. It was called the Good Enough Sex Model. And basically it's about reality, realistic sexual expectations. And he says, I think it's close to like 15% of the time sex is going to be like, wow, like really fabulous. 15% of the time it's going to be a big flop. And the rest of the time it's going to be good. It's going to be nice. So being realistic, not every time is going to be, fabulous. There's going to be some flops, but you roll with it.
Yes. And I can see how understanding, like, that's, I hate this word, but I don't know a different one, normal. That it doesn't mean that there's something wrong with the relationship, that somebody's not desirable, their partner doesn't find them desirable, or they're not desiring their partner. But it's just it's a part of being, and especially when it's been for a while that we're with someone, and love and other commitments and work, and there's so many things pulling our attention.
Mm-hmm.
But I can see how that can really have like a profound impact on each individual and on the relationship as a whole.
Yeah. A lot of times people say, like, if they end a marriage or a long-term relationship, they'll say, we just grew apart. Well, I think a
Mhm.
lot of times there's like a sexual disconnect, that they just don't turn towards each other anymore. They turn away. And then that's, it's not good. It's not good. And the other thing is, like you were alluding to, is like people make up stories that aren't true. So
Mhm.
sex doesn't go the way you want or the way you envision it should. Well, my partner's not attracted to me. They don't want me. I don't look like, the women or men in porn look.
Mhm.
I'm
Yeah.
not, yeah, I'm not adequate. And they make up stories that just cause suffering. So a lot of those stories really need to be reframed because they're not true.
That is spot on. The stories that we say to ourselves, these like limiting beliefs. I think
Mm-hmm.
all of us are guilty of that at one time or another. And
Mm-hmm.
I know for me, I spent quite some time like in that more negative mindset. And it depends on circumstances too. Like my background prior, like functional medicine now, previous women's health, but then oncology.
Mm-hmm.
So when I was in oncology, you have somebody going through the treatments, and their body changes, and
Yeah.
they may not feel the same inside of their body, and that can be really difficult on a relationship. And I remember like so many amazing individuals talking to me about how like they're like you said, they're turning away from each other in the bed, and then feeling like it's them, like I'm not good enough, it's because of the changes that my body went through. And that's so hard when we have that inner dialogue, that
Mm-hmm.
story that is likely not true.
Right. Right. And they're not sharing the stories. And so
No,
that's unfortunate that that population does not get the help they need. I think it's negligent because people, and I'm not blaming anybody, I'm just thinking we need to do a better job.
we
That
do.
somebody going through cancer treatment, they're not taught about ways to slow down or prevent things from happening. It's
No.
like, once something's occurred, okay, let's try and reverse this. No, let's get on top of it from the beginning, so it doesn't, so you can preserve as much tissue, as much function as possible. But that's a whole other story
Yeah,
too.
we could do a whole separate show about that. I'm very, very passionate about that because it impacts lives, quality of life, and can be the difference between having a happy relationship and maybe even not having that relationship anymore at all because of
Yeah.
the inner dialogue.
Well, and not even knowing how to get started and having so much vulnerability. So I'm going to share this story. I call it the peacock story. So I have a friend who, she was friends with this couple where the male had prostate cancer and he had a prostatectomy.
Mhm.
So early on after his surgery, she asked me if I would talk to them. And I said, sure. So I went to their house because we were out of town. And they didn't get any information about sexual function, about, how, here we are. We have no idea where to start. And so what would have happened is they would have ignored, and probably they never would have had a sexual relationship again. So, and they're a pretty conservative couple. So I went over and just like explained things matter of fact, and normalize things and help them imagine what it is that they still want to experience. So, like, really helping them create this vision, or really pulling the vision from them of what it is that they want to experience. Because that, when you have this picture of something beautiful, it's going to help motivate you to move forward towards it. So, we talked, and then she took me back to my friend's house, and it's a great story. So then the next morning she called and she said, when I got home, he was in the bedroom. And then the next morning, so they were intimate in some way. I don't know the details, but it was good. And she said the next morning he was strutting around like a peacock. So it was like, with because of that discussion, honestly, because I've seen this enough, it changed the course of their life.
Mhm.
because so many people get like, I don't want to bring it up. I don't know what to say. I don't want to hurt them. I don't want to embarrass them. So nobody says anything. So they stop touching and they have a companionable relationship, which is
Well,
something they wanted more than that.
yes. What an impact you
Right.
made on
Well,
that couple.
yes, yes. And that's why, just like we were talking before we started about like you're one person. So you would be saying the same things over to patients over and over again. And you're like, you got to get this information out. So that's actually what I do now is I educate healthcare providers so that because so many healthcare providers want to help and they
Mhm.
absolutely have a lot of tools, but they just need to know how to start the discussion and trust that you don't have to have all the answers. Sometimes an empathetic ear goes a long way.
Yes. And that's definitely something that I've seen is missing. And like just going back to even the concept of the cancer care, that
Mhm.
there's so many amazing tools for somebody, especially locally where I am, like they can have access to different assistance and help and guides with things. I've never
Mhm.
heard of anything with for sexuality. And it's unfortunate. Like we need you out here.
Well, that's why I'm trying to train healthcare providers, and so I mean that's my passion. But one other myth I want to bring up is that sex ends at menopause.
Oh,
It's
don't get me
absolutely,
started.
yeah. So a lot of people think like, oh well, my body's changing. I start to experience pain. It's over. There's nothing you can do about it, and that's not true. There are couples,
Mhm.
many couples, who have great sex into their 70s and 80s, and it doesn't look
Mhm.
like it did when they were in their 20s or 30s. It looks different, but it can be even more satisfying because it's not so goal oriented. It's like encompasses the whole body and eroticism and sensation. And so, and then the other thing is after menopause, say a woman is older, um, maybe an empty nest. So there's more time. People become more accepting of their body. They'll say, hey, I'm not, forget the perfect body. It's not going to happen. But I appreciate the body I have, and I'm going to enjoy the body that I have. And so they are more accepting and they ask for what they want, become, more verbal. And I also tell people, or I ask them to think about this when they really have a lot of inhibitions and feel really vulnerable. I'll say, just imagine yourself at the end of your life. You're 85 years old and you're looking back and you say, wow, I'm really happy. I just kept myself so inhibited. I'm really glad I never experienced myself as a woman, my full sexuality, sensuality. I doubt if they would say that to themselves.
Yeah, that's a really great point that
Give
we
yourself
have.
permission.
Yeah. And there's stages, there's obviously stages of life,
Mhm.
but I find I'm turning 50 this year. So I feel like the older I get, not only am I hopefully getting wiser, but I am much more like accepting of myself and
Mhm.
feel more at ease in my own skin and to that if I have something that I want or need, that I can give a voice to it. So
Yep.
that's something that with all of the people that I work with, it's a really big part of it is like what do we believe? Like what do we believe about ourselves? What do we believe about our future? Like this isn't exactly along the same lines, but I always ask people before, usually before I even start working with them, do they believe that their body can heal? Because it's if we have that perception that we're ruined, and I can like liken that to things just so don't work the same, or like I don't have the same desire and things like that, that it'll never be good or even better, that it could be like you said, like
Mhm.
couples into their 70s. I'm turning 50. I want that to be me when I'm 70, 80, 90 years old, to
Right.
have like the most robust life as possible.
Right. Because sexual energy is life force energy, it's vitality. And so people like so this story about like that older man in the nursing home chasing around the women, right? And so think about it, in a nursing home, there's a lot of death, right?
Mm-hmm.
So, what is the antidote to death? Is life force
Mm-hmm.
energy, is sexual energy. So, stop making fun of people and understand where they are and maybe why they're behaving the way they do. How a little empathy goes a long way. So,
Yes.
yeah. So, sexual energy is life force energy, makes people feel alive.
I actually love that you brought that story up because I remember like
Mhm.
being like when I did my one of my clinicals in a nursing home and when I worked for hospice and I remember going to different nursing homes, certain individuals would have that label. And
Right.
for me, it always brought a smile to my face.
Mhm.
Like
Yeah.
like you said, that's they're like full of life, like seeking life instead of just waiting for life to be over.
Right. Right.
Looking to get the most out of it.
Right. And when I say that about the nursing home, it'd be nice. The ideally is if they had privacy, safe sex
Mhm.
practices that,
Yes.
they how to keep themselves safe and that they can consent, just because
Yes.
somebody's older doesn't mean they lose their ability to consent and make decisions if they're of sound mind.
That's vitally important. And I'm glad
Mhm.
that you brought that up. That's
Yeah.
it cannot be, that needs to be in place
Right.
without a doubt. So
Right.
so you said we've done debunked two myths so far.
Yeah.
So the desire component, and then things may or may not go according to plan. Can you give us just one more, just to
Another myth.
yes.
Um, okay. This is an important one. Sexual satis- Sexual satisfaction is based on sexual function. So, in order to have sexual satisfaction, you have to have everything functioning properly. Nope, not true. So, sexual satisfaction
Okay.
is not equated to sexual function. It's about finding new ways to experience pleasure. So, as Emily Nagoski says, pleasure is the measure. So, it's all about pleasure. And they also talk about, like, okay, when is a male sexual prime? So, what do you think? And what's the story you've heard
Well, the
about the male?
story that I've heard for years is like teenagers and women is in their 40s. Like that's like
Right.
I'm sure that you've got something to say about that.
Not true. So, sexual, how good somebody is as a lover is dependent on a lot of things,
Mhm.
right? Their mind, emotions, their physical body. So, that male at 18 probably has the best endurance. So physically, they may be at their prime, but that does not mean that they are a good lover.
Yes.
Mentally present, know how to read each other's cues, to be in tune with one another, to communicate, read each other's bodies, things like that are what makes somebody a good lover. Somebody who's present, who can be with you, who can see you, who can be willing to give and receive pleasure.
I love that you said that to see you. And
No.
I actually want to like underscore, highlight, circle that. That's
Mhm.
something I hear a lot. And if I'm being perfectly honest, I've felt that way before. Like, hello, here I am, like not feeling seen.
Yeah.
It that impacts everything. And it isn't about necessarily the performance,
Right.
but all of the other aspects of what I'm guessing relate like equate to intimacy.
Right. Right. So when a couple's together and they're intimate, like really seeing each other, being in tune with each other, I mean, that's what people want. They want to feel special. Love is about feeling special, like that I am more important to this person than any other person. And so that, when is the time that you can be most intimate, as close as you can physically, emotionally, mentally, and then this is a doorway to altered states of consciousness of like really amazing things that being in that state of love than pleasure can take you to.
Yeah, and I feel like so many couples out there may not be getting all the pleasure out of life that they could.
Right. And where are people getting their education about sex?
Where are they getting their education about sex? Fifth grade, I'm feeling like that.
Yeah.
Or
They get
TikTok.
this much in fifth grade. Well, that's another thing, is that they're getting it from porn. And that's what they're learning. So what they see in porn is really about, where you're going to insert what and how fast you're going to thrust, right? That's what you see in porn. There's no, in a lot of porn, there's no heart, there's no connection. And so a big problem that I'm seeing is a lot of young, healthy men with ED, with erectile dysfunction. And what I believe, what I know should happen is that in middle school, when kids are taught about alcohol, smoking, seatbelt use, all these safety things, they should also be taught about how to take care of your body, physically and sexually. And so what I see a lot is these young men who call me, or the urologist referred them to me because there's nothing wrong with them physically. And they have been viewing porn from the time that they were maybe 12. So most kids have a cell phone in their hand. So when they go to self-pleasure, they have a visual. And what does that visual give you? It gives you novelty, intensity. It gives, you can, click, click, click. Every time you click, 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 you see something more exciting. You're releasing dopamine from your brain. So this virgin brain, think of it as a clean slate, is now being wired to become sexually aroused with high levels of dopamine. And they do this several times a week or more for years. And then they go to be with the real partner and they're not releasing that level of dopamine. And so they're experiencing ED, which leaves a healthy young man to feel like they are broken and to become depressed and not want to get involved in relationships and now are lonely and isolated. It's a big problem. And so many of the men that I work with who came to me because of erectile dysfunction, most likely brought on by porn, excessive amounts of porn use. They say, I wish I would have known this in middle school. I wouldn't have watched as much. They probably still would have watched some, but not as much, where it just becomes a habit. Like, I'm bored, so let's watch some porn. And so I really believe that this needs to be taught in the middle schools. Now, some people will argue with me and say, no, porn does not cause sexual dysfunction. And there are studies that show that it doesn't, but there are also studies that do show that that it is associated with sexual dysfunction, especially erectile dysfunction. And I'm just saying what I'm seeing and what the stories I'm hearing from these young men. So I think it's noteworthy to understand that this is what's going on out there, and let's just help our young people by educating them.
I agree. And just a sidebar about the evidence-based information out there. Definitely this audience is schooled on this, that we can find evidence for anything, pro or for or against, whatever. There's evidence. I think we need to look at it in a different way for maybe what makes more sense. And I think what you brought up, quite frankly, is somewhat shocking. Right?
Right. People are shocked.
Thinking about middle school and no shade to the teachers, because I have a lot of friends that are teachers, and I know that a lot of teachers listen to this podcast. But if it's not in there, if it's just basic things, but we're not bringing front and center, I do think that it matters. Frankly, I think there's an issue. Don't anybody come for me in the comments about cell phone use, just in general.
Oh, yeah, yeah, creating barriers.
How hard is it to get people's attention sometimes? And I see this everywhere. Like, my husband and I go out to eat, and this is all you see. People are out at a restaurant spending good money on that food, and they're just completely engrossed in doing this and sliding and scrolling. And dopamine, that it's hard to have a conversation. So if
Yeah.
I think most people would agree with that. That's
Yeah.
why there are these like lock boxes for cell phones and things on a computer to like turn off Facebook and Instagram so that we're not overly flooded, and it is going to have an impact on our hormones. That's
Right.
that's one of the things that I teach is when we are flooding our brain with this stimulation, overstimulation constantly, and not from like natural things, then that's going to impact, obviously, neurotransmitters is going to impact our hormones. It's going to impact every part of our body and cellular process. So it makes complete sense to me that
Yeah.
if we have essentially children for years of their life overly stimulated and equating it, it isn't real. So
Right. So this is another thing. So prior to 2006, the incidence of ED in men under 40 was like 3 to 5%.
okay.
Now studies show that it's like 30%, even some show higher. And in 2006, that's when high-speed internet porn came in to play. And so I really believe that's a factor. And the other thing is that I think porn is an example of a product coming out before the research, just like smoking. So prior to 1964, when the Surgeon General came out and said smoking is dangerous, it can cause cancer, people, you're feeling anxious. Oh, to have a cigarette, right? They didn't know they were harming themselves. Then the research comes out and they're saying that, yes, smoking is associated with all these health risks. Mm-hmm. Same with porn. Porn came out, and now we're seeing the result of, I'm talking about excessive amounts of porn, the effect that it's having on people. And I think that I really think it's negligent not to educate people. Just give them information, and then they can make their informed decisions.
Yes, I'm a fan of informed decisions, mm-hmm. right? And let's gather the facts. And there's a lot of opinions out there. I'm a very opinionated woman myself, mm-hmm. but I also care about data. And so not just and data and what makes sense. And I look at trends. So you mm-hmm. said there's a dramatic difference between years ago and now. And like I look at that because one of my specialties is the immune system and autoimmunity, on mm-hmm. how that's on the rise, and my beliefs for why that is. So I feel like it makes total sense. Yeah. And you also said that there's a difference between excessive use and maybe, what term could we use? Intermittent?
Occasional.
Occasional. Yeah. And yeah. Like, not to put you, I feel like the listener wants to put you in the hot seat.
Oh, they do, but I'm just reporting.
I'm channeling the yeah. listener right now. Do you have a hard, like, core stance, a line on porn? Like, is it ever okay? Is it never okay?
No, I think it's okay. And it really helps people. It helps, build their arousal. It helps, people have low desire. It helps get them in the mood. So it can enhance sexual relationships. I'm talking about teenagers whose brains are being wired. Yes. That's what I'm talking about. I'm not talking about people who use porn to help build arousal. But it's a problem when they keep going to porn instead of their partner, and then that's mm-hmm. all sorts of other things. But one thing this came out in Medscape last week about this thing that healthcare providers need to know about that's happening out in the world sexually. So they did a study for college campuses, and they found that choking or strangulating during sex is very common, and that a third of the women reported the last sexual event involved that. And so the day after, I just started asking my patients. I said, I just read this. I didn't know about this. And I was like, wow, have you ever heard of this? And two of them, I only asked two people, and yes, they do that. And So it was very interesting discussion. But we, as healthcare providers, we need to know that there are serious consequences of this. We see people with, migraine headaches, tinnitus, and dissecting carotids. So
Oh my
stroke.
goodness.
Yeah.
This is,
So anybody under, what they said, anybody under 45, if they have a stroke, start looking for causes. But start asking these questions, because a third of them on their last sexual event, this happened. It's like, wow. So now I'm asking everybody about that.
That's, I mean, I feel like I don't get shocked very often. That's mind blowing to me.
So where do they learn this? So I said, where do people get their sex education? They get it from porn.
Okay.
So there's a lot of that goes on in some pornography.
Okay. I must be living somewhat of a sheltered life.
Yeah. Me too. But
over here, that is, I feel like I need to use the word disturbing. I think it's disturbing, and
it's very disturbing
for consequences. And you said that this just came out.
This was last week.
I'm a research nerd. I tell my patients and clients I need to get more of a life, because I'm constantly in it. But I'm usually not looking up things related to sex.
Yeah.
Might have to include some of that.
That's what we need to know. And I mean, there's all sorts of things that we need to educate our patients on that are dangerous, including what we're seeing with HPV, but that's a whole other subject. Yeah.
Well, kind of piggybacking off of this, the concept of porn, and what about a couple where one of them is watching porn and the other one and by themselves, and the other one isn't? What's a strategy? What's a strategy there?
Well, it depends on if they're bothered by it. If the person who's viewing the porn is bothered by it, or if their partner's bothered by it. Like some people will be like, go watch porn, take care of yourself. Yeah. But others are like, they keep turning to porn, because porn, there's no expectation. There's no performance issues. You don't have to, feel like you're going to disappoint someone. You don't have to put all that work into it. For
not doing anything for anyone else.
Right. So, when you find that you turn to porn rather than your partner, if it's taking time away from your life, if you're like, it's affecting work, it's affecting the quality of time you have with your family, you're staying up late and you're exhausted the next day, that's a problem that you need to look at.
Yeah. One of my, back from my IFM days with functional medicine, I had one of the instructors. She was amazing, and she said the only reason for a TV in the bedroom is to watch dirty movies together.
Yeah.
It just reminded me of that, and it was kind of surprising when I heard her say that. And so, but I think it's important.
Yeah. So one of the things that a lot of women get frustrated over is the amount of time it takes them to get aroused, because it does take time. And so some people will view porn. It helps, to build that arousal. Or vibration is another thing that I really recommend to people to help enhance pleasure, because vibration, so using a vibrator, brings blood flow brings arousal brings pleasure. So use whatever you have to help enhance the experience.
Yeah, I think we need to talk more about this, because it's almost like it's all a secret. Everything is like, don't, like, especially those of us with female parts, like for somewhere along the line, and you let me know if you feel differently. It's almost like we weren't taught anything, or hardly anything, about sex and intimacy and arousal, but it's almost like it's taboo for those of us with female parts, or we don't need it. And I remember, and maybe I'm giving away my age here, but I remember growing up and hearing like, oh, that's not anything that girls are into. That's just guys.
Right. So
it made no sense to me.
Right. I know. So there, the messages that you get wired. So,
Mhm.
especially like certain religions, that sex is bad, sex is only for marriage or for procreating, that it's dirty, to touch yourself is dirty. So all of these messages, they really are wired in people's brains, and then they suffer because of this their whole life. That they stay inhibited their whole life because good girls don't. Messages that they got, growing up, and
Mhm.
that, or that sex was never talked about, that it was always, shrouded in secrecy and shame. And so, like, and there's something bad with it. And so, something that can be so beautiful and life enhancing and really solidify and take relationships to new levels. It's like, man, what is wrong with us that we're not talking about this? It's really, I still, I can't believe that people are so shut down about talking about things like this, but it is. And so that's what we're doing. We're trying to change this and normalize it.
Mhm.
Um,
That's why I'm so glad to have you on the show today.
yeah.
Because
So there's a
again,
lot of, yeah, people are suffering with, like, low
yes,
desire, sexual performance anxiety, um, arousal concerns, all of these things can so easily be taken care of and shift the quality of somebody's sex life. And so that's what we need to, we need to educate our healthcare providers so that they can offer these strategies and know that, let their patients know it's okay. We can talk about this. It's important. And then
yes.
also, healthcare providers just adding it as to part of the questions that they ask. Do you have any sexual concerns? Normalizing, like, lots of people are on medication. So many people who are on
Mhm.
antihypertensives or whatever can experience problems with, arousal or SSRIs. Sorry about that. SSRIs can cause it, it takes longer to get aroused. So just normalizing that and giving people information ahead of time. So anticipatory guidance, just like we do every place
Yes.
else. Yeah.
You're speaking my language there. And I love that you said, normalize it. I,
Right.
I feel like when we make it bigger, like such a big deal, like you brought this up earlier, and I feel like it's definitely it's worth repeating that if we have if our partner or if it's us experiences like has an erection and then it goes away, or we're not getting an erection, that it doesn't have to be bigger than it is. It doesn't mean that we're never going to be able to do this. Like you said, if it happens one time, then there's like this weird feelings, and then, well, we can't do anything, and that means we didn't have sex. And the
Yeah.
next time, less and less and less. That if we just like say it like it is, like it can be. I hate this word again. I'm going to use it again with air quotes. It could be normal, and it doesn't have to mean,
It is normal.
yeah, that things are like doomed. I feel like we're in like a all or nothing mentality society, and
Mm-hmm.
like a doom and gloom. Like, well, I'm in my 50s and it's just part of it. And maybe some of that, maybe there's some truth to that, but I love the idea of normalizing.
Right. And so, this made me think of something else. So, women postmenopausal, you
Mhm.
get genital urinary changes. So, GSM, genital urinary syndrome of menopause. So, it's when estrogen levels drop, it affects the vulva and the vagina. So, the cells, you don't lubricate as well, more
Mhm.
likely to tear, things like that can happen. But there's something that can take care of that. So, like topical estrogen, and people are afraid of estrogen because of the Women's Health Initiative, which that study, there's a lot of flaws in this. But I'm talking about
Yep.
topical estrogen to the vulva and vagina. And that
Mhm.
can preserve cellular function so that people can have comfortable sex. They do continue to lubricate and enjoy sex. So
Yes.
why aren't we treating all postmenopausal women?
It's so important. And also I remember prescribe, topical DHEA. I've seen really great success with that also, but
Mhm.
normalizing it, I like that
Right.
concept. I
You
want to
moisturize your face, right?
yeah.
So moisturize your vulva and vagina. So vaginal moisturizers, lubricants with sexual activity, topical estrogen, and the blood levels don't increase to levels that are
No.
higher than postmenopausal with topical estrogen therapy. And, not only to preserve sexual function, but as estrogen levels drop, you see more urinary tract infections,
Yes.
more external dryness, irritation, so discomfort. All of these things can be easily managed with estrogen and topical estrogen I'm talking about. And,
Yes.
so, people die from urinary sepsis, from a urinary tract infection. This can be prevented.
And it's very common. I remember it was the most common reason for somebody to come into the office that I worked at.
A UTI?
Yeah.
Yeah, right.
Yeah.
So it is. I mean, it's shown it does help to prevent UTIs and dysuria and other, urinary symptoms. So things like that, why aren't we doing this? Why are we trying to reverse something when somebody's experiencing pain or is having numerous UTIs? Why not manage this from the beginning to slow the progression down? Because GSM is progressive. It's just going to get worse over time. So why don't we treat it now so that doesn't happen?
Yeah, you're speaking my language of swimming upstream.
Mm-hmm.
Right. And if we get a UTI, we're thinking about antibiotics, but we're not thinking about the reason behind it. And it's because it is so common. And then the myriad of issues that can occur downstream from this Band-Aid approach versus something that can literally change the course of a woman and a couple's life.
Yeah.
When feeling more like themselves instead of almost living in secrecy, keeping it to the or doing that no, not tonight, no, because they feel like there's something wrong with them and people are not talking about it.
Right. And if you experience pain, you don't want to do it, right?
No.
And then, so it's another thing about educating people about symptoms. So ED. So when a man experiences ED, you need to look for causes. So erections are based on blood flow, right? So some of the smallest blood vessels in the body are in the penis. So cardiovascular disease doesn't just occur in the heart; it occurs systemically throughout the body. So where are you going to see symptoms first? You're going to see them in the smallest blood vessels. So we think of ED as the canary in the coal mine. When this starts to happen, look for causes. Lifestyle changes, cardiovascular disease, because it's shown that ED can occur 3 to 5 years before the onset of symptomatic cardiovascular disease or diabetes.
That's so vitally important. And we're not looking at how the body systems are connected. I love that you brought that up, because I don't know very many individuals that are thinking of it as something cardiovascular. It's more like something's not working, or it's my age. And I have that, just, it's cringy.
Yeah,
I kind of love that word. It's cringy to me when somebody says, oh, it's just part of getting older.
Right. And that's not true. That's not true. You don't have to experience pain with sexual activity. So for, a woman, or also, so just like ED, looking for when it occurs, look for underlying causes. Same with women when it affects arousal like that. So same thing, blood flow, clitoral blood flow, what's happening here if there's a sudden, decrease in ability to get aroused.
And I feel like it's so important, like you said, of connecting the dots for how things evolve. And actually, I really like that word, evolve. So instead of saying, even the word change, depending on how somebody takes it, it could be looked at like negative, versus evolve. So the relationship evolves. People become we're so close. The longer we're with our partner, it's we can finish each other's sentence, and there's such a comfortability feeling. I mean, at least I hope there is, when people are together for a while, that it is an evolving of the relationship, that the sexual intimacy is different, which may or may not be different, but it evolves. So kind of
Right.
going along those lines, what kind of strategies do you have for couples that are
Yeah.
like looking to enhance their sexual satisfaction?
Right. Lots of things, but you just made me think about grief. So, we talk about grief a lot, and I don't know. I read this recently, like how well we do in life, manage it in life, is how well we grieve, because we're going
Mhm.
to have losses our whole life. When you're young, you have to change schools, or parents get divorced, or you lose somebody that you love, or you. So now I don't get as aroused as I used to, or my body doesn't look like it used to. Those are all losses, and how do we move through that and accept it is a something that I really think we need to look at more. But you asked about how can people enhance their intimate lives. Broaden the definition of sexuality. So it's not just about intercourse and how hard erections are and if you orgasm. So make it whole body, make it an emotional thing, a mental thing, experiencing different kinds of touch. And that's why I like to go back to sensate focus a lot. So
Mhm.
a lot of people probably don't know what sensate focus is, but it was something that Virginia Johnson developed or came up with. So Masters and Johnson, they were the sex researchers back in the 70s. And so when Virginia Johnson was a little girl and she wasn't feeling well or whatever, her mother would just stroke her cheek or stroke her arm. And it was very soothing, very calming to her. So that's how it all started. So I use Sensei Focus a lot in my practice. And I think that all couples can enjoy Sensei Focus. So what it is, it's about slowing down and giving and receiving touch. And it's not erotic touch at the beginning, the first few times you do it, because you really want to focus on touching the entire body without a goal of where you're going. So you take turns. So 15 minutes or 20 minutes, one person's a giver of touch and the other person's a receiver of touch. And it's hard for some people to receive touch, like especially women, because they're always givers. So for them to just lay there and receive touch, it helps them learn to be able to to receive sexual pleasure too. So that's a good thing there. So and then they discover parts of their body that they didn't know felt so good to be touched. And I'm not talking about just like erotically, but just certain areas that just feel really good. So it's not massage. It's not like this. It's like just really light, feathery touch, because that activates more sensory fibers. So when you do Sensei Focus, really the focus is on what am I feeling? What am I feeling? What am I feeling? And this is a great strategy or tool or practice, I should say, to learn, because one of the biggest problems people have in the bedroom is this mind just won't quiet down. I'm thinking of all the things that I have to be doing. And so Sensei Focus is how it's a mindfulness practice, how it teaches you to stay in your body. So where does good sex happen? It happens when you're in your body. And
Yes.
so that's the focus. And also when you do it for, a few minutes, 5, 10, well, it depends on the more you do it, the better you get at triggering that relaxation response. And so, arousal occurs oftentimes in a relaxed state. So stay in your body, discover places that feel good, and relax.
You like this, your like what we're talking about right now totally brought me back in time. I'm going to share a short story
Sure.
with
Yeah.
you if you don't mind. And
Yeah.
it is not an erotic story at all, but
Okay.
just the concept of the light touch. Because I'm a massage girl, I believe in massage. I get massages and I love it. And I'm not the one laying there not wanting to be touched. I'm like, go for it. But when I was growing up, my sister and cousins are going to probably kill me, but like we were like the children that would like rub each other's arms like really lightly. I feel like it
Yeah.
was like my mom that like started that,
Mhm.
like to help me go to sleep.
Yes.
Like, just really like almost like close your eyes and barely touching.
Yeah.
And there was something so powerful about that. So we would literally sit in a circle. We were very
Mhm.
close growing up. Obviously my
Yep.
sister and I, and my cousins, and we would like rub each other's arms like
Mhm.
in a circle, and or we would also set timers, and we did this for years.
Yeah.
And I remember like I had friends that thought it was so weird, and like some other people in the family, like, what are you guys doing? And it
Yeah.
was just obviously innocent, but there was something, I didn't know it at the time, but it was like bringing us to the present,
Hmm.
to, and this is, I guess you're bringing it out in me. Like I'm sharing way more than I normally am ever comfortable doing. But I've had this thing for most of my life, and I'm still working on it, but I've come a long way, where I'm always living in the future.
Mm.
Like not like, or not that I'm not satisfied or happy, but I'm constantly thinking about tomorrow or next week or next year, and
Hmm.
can have always found it difficult to just be,
Yes.
just live in the moment. And I feel like I need to bring that back in my life, because I remember it, I was so little, but feeling so peaceful,
Hmm.
especially in, we're here in Tara's life story today, especially with so much of the like the difficulties like most of us have in childhood and different traumas that
Hmm.
my family, like I experienced, that was like one of like the best memories that I have. And
Hmm.
I've never really thought about that. And I think it's so important that you said like sex doesn't have to be
About genitals and
put
friction.
in and out, right? That like this more like touch, bringing
Hmm.
us into the present.
Hmm.
That is a huge clinical pearl that you just like divulged to the listener. And so that's, I love that strategy. Any other, we don't want to give away all your secrets.
No, no, but that definitely helps with that, called cognitive distractions, like this mind that just won't stop. Well, what do you do when my mind keeps going? Come back. What am I feeling? You've got five senses, right? So you want to get in your body, enter your body through senses, and touch is the one that most people associate with sexuality. So my mind goes, what am I feeling? What does my partner's skin feel like? What do their muscles feel like? What does the skin to skin contact feel like? Just get back in your body, back in your body, back in your body. And as arousal builds, then the mind starts to quiet down so they can actually be present. And so as arousal builds, I think it's like a vacation. It's like taking a mini vacation. Sex can do that for you, sexual intimacy. And so as arousal builds, the blood flow to the prefrontal cortex decreases. So now I'm not thinking about things anymore. I'm totally present in my body at that high level of arousal. And it's like, when does that ever happen? So it's like so healthy. So that's why I really encourage people to use things that can help build arousal. And I mentioned before, vibrators,
Mm-hmm.
because people get really frustrated. Oh my gosh, it takes 20 minutes to get aroused or whatever. Well, a vibrator can cut way down on that time. So now instead of like feeling frustrated, I'm not getting there, it can help to build that arousal. So now you're in that state of like, oh, I'm just really present. I'm in my body. I'm not thinking about things anymore. And so anything can do to help people get to that state, into a being state, rather than, say left brain, right brain. Left brain, I'm thinking, planning, executing. Right brain, I'm being, I'm present. So music also is a big one. Music really helps get people out of their left brain and into the right brain. So that's a big one for people. It can really help them to relax. Music's a big one. Um, so all those mindfulness practices are really, really helpful. And there's a research done, it's by Peggy Kleinplatz, not Kleinplatz, I think I'm saying it right. And her paper was on optimal sexuality. So they interviewed, her and her colleagues interviewed hundreds of people, and they said, tell me about your best sexual experience. And they didn't talk about intercourse or orgasm. What they talked about was this sense of embodiment, being totally present in their body, communication, entering this state of flow where you lose track of time. And so those are the things that they report that were really, optimal experiences. And when you think about that, a lot of those things are things that happen before they're even having sex. So like going back to like high school and things like that, where they're slowing down, everything, touching all over. So it's not all about friction at all.
Well, I love like the getting in touch with like right now with the present, and that it doesn't have to be, and that kind of links back to what we were talking about earlier. It doesn't have to be friction.
No, and yeah, and this being present. So it's also about giving yourself permission to, I'm going to take this next half hour and I'm going to put aside all of my to-do lists and all of the things that I'm worried about that I have to do. And I'm giving myself this gift of the next half hour. So leave all that crap at the door. And it's just to be present in my body, to enjoy my partner. So give yourself permission to take 30 minutes out of your day or week or whatever and just be in your body.
I love that. And I talk about that every day, at least once a day, usually multiple times a day with individuals, about like setting aside time for yourself, self-care, and putting your to-do list aside. And lots of people challenge me. They push back and say, I don't have 5 minutes. I don't have 5 minutes to breathe. I'm like, you're going to die if you don't breathe. So like the importance of setting aside that time, even if it's 30 minutes, and we don't go into it with the expectation of, okay, honey, we've got 30 minutes to have sex. Then I got to get back to work. Like just to be
right
without the expectation. I mean, that's what I heard you say.
Let go of expectations. Just let things unfold. No agenda. So it's like adult play. So just like you were talking about, you and your cousins or your sister would all like line up and just touch each other. That was children play. There was no goal. You were just in the moment enjoying what you were doing. Well, that's what, sexual intimacy can be like. It's adult play. It's like, finally let go of responsibilities and just play and laugh and have fun. And that's the other thing. Laughter is really important. I sometimes do workshops for women with low desire. And then we were talking about like, okay, anybody have, words of wisdom? What do you think that can also help? And people go around a circle and offer up what they think. But one woman said, laughter. We need to laugh more in the bedroom. And everybody's like, yeah, we need to laugh more.
You're not wrong. Like, I think we need to laugh more in general, like in every phase of our life. But I feel like what you're saying, it's really like really resonating with me, especially the part about expectations, or like, well, if we're going to have sex, I got to make sure like I have enough time, and can't do it this time, can't do it this. I have to finish doing this first. That it doesn't have to be, we can overly complicate things.
Yeah.
And that adds a stress.
Yeah.
Versus going back to, like you said, childhood, where everything was simple.
Yeah.
Right? Before we overly complicate things as adults.
Right. You said the word expectation, and I just want to share this other story because this was really interesting. So I was at Esalen, so it's a retreat. So it was for like all sexual health experts. And there was a couple, they were in their 60s and their workshop got canceled. So they ended up in ours. So they were with all these sexual people, and they were very brave to come into that. And so you think like, oh, what are they doing here or whatever? It's like, I try never to do that because you never know where you're going to learn something from. So the man shared this story. He said, before we got married, I said to my fiance, sex is really important to me. I know it is. I know this about myself, and it's really important. I really would like to have sex. I need it to have sex like once a week. And she said, she thought about it and she said, okay, I can do that. I need my back rubbed for 15 minutes before you touch me in any sexual way, because I need that to transition and to get relaxed. And he said, I can do that. So I think that's so important. I call it my minimum requirement couple. So, like, before you make big decisions, what are your minimum requirements for this? Because life gets busy and life gets crazy. So they identified it and they did it for like, they're in their 60s, like 40 years. And
Wow.
yeah, I see people who are like, they get married and then they lose desire and they don't want to have sex anymore. And then they don't want but their partner, it's important, their partner. And then and they don't want them to have sex anyplace else. So it's like, got a lot to look at there.
I love that term, the minimum requirement.
A minimum requirement couple. Yes.
I love your story. Yeah, I'm sure it's going to resonate with a lot of people out there. Yeah. And that we can voice what we want and it doesn't have to be the same. Right. So I love that she wanted her back rubbed.
Right.
So that she could ease in and teaching couples essentially how to communicate.
Right. So what am I getting out of it? So a lot of women will have low desire and they just, it's hard for them to get aroused or to reach orgasm. So it's like, okay, what are you getting out of this? We've got to work on it. So you're getting something out of it that's going to make you want to show up. And for a lot of people, it's a 15-minute back rub. Sure, I'll be relaxed then. Yeah, then I'll be willing to have sex. So it's, how can I make this more inviting so that I want to show up?
And I've got to ask you this question. It's been on my mind for a long time. Mm-hmm. What is there, and I don't know how you're going to respond to it, but I'm going to ask you anyway. Mm-hmm. Is there like the perfect amount of times a week or a day? Like what is the going number of not necessarily intercourse, but sexual relations? Is there a going number?
Well, if you look at research, it's like about a little bit less than once a week that couples have sex. If you're looking at research, but don't go by that. Go by what it feels right for the couple. Some people have sex once a month and it's really good sex and they're both satisfied with it. Other people, really want it more frequently. So it's like what works for that couple. And then it's about negotiating, because if one person wants it once every 2 weeks and the other person wants it every day, okay, well, what's possible here? Where can you meet in the middle? And the other thing that I'll bring up too is asynchronous sex. So this I use a lot with people because let's say there's a higher desire partner, and then the one with lower desire is like, I just really can't get into this. So they're going to say no. But are you willing to pleasure your partner? So I call it asynchronous sex. So I'm not really feeling it, but I'll do something for you. So pleasure your partner and however it is you want to do it. I'm not talking about intercourse because that would be, but doing something for your partner to pleasure him. And that works. Not all the time, but it definitely can help, fill in the gaps. And it's an act of giving. It's not coming from a resentful place. If it's coming from a resentful place, then it's tough. But if it's coming from a giving place, like I really love my partner, I care about him, this is important to him, sure, I'm willing to give 10 minutes. What's that?
Yeah, I love that making sure and like that everybody feels heard, that their needs are met, but that usually there's one individual in a relationship that's more revved up.
Right.
As I call it, and meeting in the middle, but that it doesn't have to look like what we think it should be, resulting in intercourse every single time.
Right.
As long as we're not coming from a place of resentment.
Right. So, come from a giving heart. That's the thing, is you want to really stay away from that resentment and anger, because that really damages relationships. So how can you come from a place of appreciation and a giving heart? So it might be like, oh my gosh, that's the last thing I want to do in my day, but it can take like 10 minutes. And so you just think like, okay, I love my partner. I know it's important to them. I know it'll make them feel good. So I'm willing to do it. That's no problem. So it's coming from a giving, generous heart.
And then
It is.
everybody is at peace with
Yeah.
the
Yeah.
result. And it
Right.
it would bring people closer together.
Yeah, because I understand that this is important to you, and so I'm the only person who can do this for you. So I'm willing to do this out of an act of caring and an act of generosity, because I want you to feel fulfilled.
I absolutely love this conversation. I'm sure the listener is getting so much value. Have we missed anything? Any other clinical pearls for individuals that maybe you're feeling that their sexual life is not what they want it to be? Or even like for practitioners listening, like any clinical pearls all around that you feel the listener really needs to know?
I think that giving people permission to not be perfect, helping people learn to stay in their body so that when they are intimate, they're not on the sidelines critiquing like, oh, I look fat, or I have cellulose or whatever. But how can I learn to cherish this experience, that my body that's created this way can experience pleasure, and I'm going to enjoy what it can do, and I'm going to stay in my body and experience from the inside out. So not up here, but I'm in my body and I'm experiencing this through all of my senses. That's so self-compassion. You don't have to be perfect. Accepting what is right now, knowing that it won't always stay the same. So if you're recovering from an illness or have an illness, like, this is where I am right now, it doesn't mean this is where I'm always going to be. Or this is where I am right now. I'm flooded with all of these responsibilities, but things change.
I love that.
Yeah. So that, and it's staying connected and staying. Oh, here's another one. This isn't. So I don't know where I heard this, but I like this. So some couples, like once a month, they call it a new moon ceremony, or just pick one date a month, and you sit down and you say, is there anything that you would like from me that you've stopped asking for? Because people stop asking because they assume, well, they don't want to do that, or they make up all stories. So if you don't ask, you're not demanding, you're just saying, is there something you would like? Doesn't mean it's going to happen, but at least it's communicated. And the other thing is for people to stop, to start listening. And so when you're talking to your partner, actually listen and get the message, and then pause and think about what your response is going to be. But really seek to understand. I think you always need to start there. Seek to understand what it's like for your partner. And then that's where empathy comes from. That's where you get rid of the resentment, when you understand what it's like in their shoes, from a place of empathy and compassion.
Yes, seek to understand.
That's where you always start.
That's so important. I feel like that could absolutely change the trajectory of a relationship.
Absolutely. Because now, if I really understand what my partner's going through, and understanding what their inner dialogue and their stories, that, like, you lose your erection, so you're not attracted to me. Like, hearing that story, if you're the person who lost their erection or their arousal, can help you make it not about you and that I'm inadequate. But here we are, two people, we're an intimate team. We're working to make this as enjoyable and pleasurable, and appreciate the gift that we have in one another together. So that's really, empathy is really important, to put yourself in the other person's shoes.
In like all throughout life, in all circumstances, I 100% agree. Empathy is missing in a lot of ways. And you said, like, take the time. Again, I'm going to go back to this because I think it's is very important. Like, take the time to listen instead of, and like you even said, to pause.
Mm-hmm.
When I hear pause, I'm like, give a beat. Somebody has just expressed themselves. Let that individual see that you're taking it in, as we should be taking. We
Mm-hmm.
should do our best to absorb and take in and hear what they said,
Mm-hmm.
versus somebody is, sharing something that's really important, and we're thinking about what we're going to say
That
next.
doesn't, you don't feel seen that way, right?
No.
That's what we're talking about, being seen. Yeah.
Yeah, absolutely. The feeling of invisibility is real.
Yeah.
I see it a lot. People express that to me, and
Mm-hmm.
it can be a game changer. And that's why I feel like it's so important to learn this and
Mm-hmm.
work with somebody and talk about it and make it, normalize it, like you said, so it isn't, there's something wrong with me, he's not as interested or she's not as interested, and it's part of getting older, and it's because I've been through this, or we're too busy. That it is important. It's an important part of life and health
Mm-hmm.
and relationships. Maureen, I have absolutely loved this conversation. And
Me too. Thanks. I appreciate
how
it.
can, absolutely, how can the listeners find you, learn more about you? What is the best way?
Go to my website, which is drmaureenryan.com. So it's drmaureenryan.com. You can find me there.
I will link that below. Thank you so much for coming on. You've given me so much to think about, and a lot to think about with regards to my patients and clients, and things that I didn't know, some of the things that we talked about. So thank you so much.
You're welcome. It's my pleasure.